Other factors that will affect your heart rate, right? Number one, your age. What happens to your heart rate as you get older? Goes down, right? Yes? Gender. How's gender going to affect your heart rate? I'm sorry, you're going to have to speak louder.
Are males faster? Is the heart rate higher?
Okay, good guess, but not correct. No. As a general rule, not me, but most men, they're bigger and stouter than ladies. They have more muscles, right? And their heart, boom, boom, is more powerful, and it's a slower heart rate. Just like a trained athlete has a slower heart rate. As a general rule, little bitty ladies have a faster heart rate. Okay? Okay, so age, gender, exercise. If you're fit and you run all the time, maybe you're a marathoner, your heart rate's going to get slower, okay? Just from years of exercise, okay? And it's normal, if you're a marathoner and your heart rate's 42, if you're just a regular 60-year-old guy that does no exercise, that ain't good. But if you're a toned marathon runner and your heart rate's 42, that means you're probably a pretty good marathon runner, right? See, so that may be normal. Okay. Body temperature. What happens to when we get super hot? What happens to the heart rate?
Yeah.
It goes up, right? Because you're pumping that blood to the surface. When we pump that blood to the surface, right? Remember, the blood's like the radiator fluid, and it radiates that heat. Yes. So you feel hot and sweaty, right? But anyway. Okay. Okay. Tachycardia, Tachycardia, and bradycardia, Tachycardia over 100, bradycardia below, let's see, what is it, 60? Yeah, 60. Below 60, both of these are beats per minute, BPM, okay? Tachycardia, heart's beating too fast, too fast. Bradycardia, okay? I'll tell you the story. I always remember bradycardia because one of my friends I went to college with 40 years ago said he worked at a gas station and this old man would come in to get gas and it was old Mr. Brady and he walked like this. Old Mr. Brady, he's so slow, did everything so slow. And he said, I always remember bradycardia. I've always remembered that, right? Bradycardia too slow, right? Now, my heart rate's about 60 commonly, right? So technically that might be bradycardia, but I'm exercised up, and that's probably why it runs there. And at times it's higher than that. It's common. Yes? Okay? Now, tachycardia, right? If your body temperature gets too hot, if you're stressed out, very common with drugs, and also heart disease. If your heart's not going boom, 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 and pumping out blood, it's not very strong. If it's failing, then it may be boom, 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 trying to keep up. Okay? And again, bradycardia, low body temperature, inadequate circulation. And two, we talked about if you fall and hit your head and you get swelling in your brain, then your heart rate may go lower, lower, lower till you die because of swelling of the brainstem, right? And remember, that's where the cardiac-acceleratory and inhibitory centers are, right? There's also a pontine on your pons, the little bone that sticks out on the bottom of your brainstem there. That too, right? Congestive heart failure, right? Okay, there's a bunch of different names for this. Names come and go, but basically, congestive heart failure is when your heart becomes an ineffective pump, right? When your heart's not strong and the pump just gets weaker, weaker, weaker. Okay? It generally gets worse over time. okay? And it reflects a weakening myocardium. Remember, myo means muscle, and the myocardium is the muscular part of the heart that does the contraction. Okay, and let's talk about some of the reasons for it. Number one, high blood pressure. Okay? Now, high blood pressure is very dynamic. It goes up and it goes down. Late in the evenings, I'll take my blood pressure, and sometimes it'll be 90/60, right? But if I'm at work and I'm busy and I'm running here and there and putting out fires, then my blood pressure may be 138/92, right? Or white coat hypertension, you've heard of that, or white coat syndrome. Yeah. I had a young fellow, slim, trim, about 20 years old in my office the other day. Well, I've never been to the chiropractor before, you know. His blood pressure was 150/98, right? Now, his blood pressure does not run like that. He was scared. He was nervous, see? So that is one of the reasons. But if your blood pressure runs high for long periods of time, then what happens is that it damages the heart, okay? The top is called systolic, of course, and the bottom is diastolic, right? And for many years, they worried about systolic, get that down. But they discovered, guess what? Diastolic is very, very important too. And let me explain why. Diastolic is when the heart relaxes. It's the low number, it's the bottom number, okay? We said the heart beats 24/7. And when does the heart get to rest? The heart gets to rest that split second that the heart relaxes. And if the heart does not get to relax, if the pressure's too high, you can take that for a short period of time, but not, and many times it's not a week or 6 weeks or a month or 6 months. It's 10 years, it's 15 years of running that blood pressure too high, and it damages your kidneys. Okay? High blood pressure is very, very bad for your kidneys, and you will start to get kidney failure later. Okay? Also, too, think about this. You remember we talked about how Wolff's Law, how the body, to try to strengthen those bones, puts calcium? Guess what? Here's a blood vessel, and you got your hydrostatic pressure, right? And that's the pressure of the blood flowing through, right? Guess what? If that pressure is pushing on the inside of that blood vessel, and that blood vessel is getting stretched, right? And what happens is, guess what? You're going to get a stiffening of that. You're going to get a stiffening of those blood vessels. And when the blood vessels can't relax, when they get stiff, it's called compliance, right? Then your blood pressure is going to be high, and eventually you're going to get calcium building up in the walls. Oh, by the way, atherosclerosis, or how about hardening of the arteries, right? You ever heard of that one? Yes. From that blood pressure being too high, okay, for long periods of time, not when you were running a sprint, but if you're laying in the couch at night watching Netflix, like I know you do, Joseph, right? If you're doing that, then that's way bad. Ladies, let's face it, most of the time you're the boss, you're in charge of your family, and you're in charge of your family's health. And if your husband got high blood pressure, there's no signs or symptoms until right at the end, right? If you want that man around for a long time, see his grandkids, you better watch his blood pressure. You better take care of him, because it's up to you, because men are not doing anything about it, are they? Right? If they get a flat tire, they'll change it, but they ain't going to the doctor and check their high blood pressure, are they? No?
My husband does have high blood pressure.
Okay, that's why. You want him around for a long time, right? Yes?
Very true.
2, when you get retirement age, do you want to go to Europe and travel the world and see Alaska and take one of them cruises and all that crap, or you want to be home taking him back and forth to the doctor in a wheelchair? No, it's very simple, right? Because men don't take care of themselves. Because men are idiots, right? Yes. I'll sit. I don't change, but
It's a
anyway,
woman
right?
stubborn too.
Oh, don't let me go there, girl. I've been married 35 years. Don't let me go there. Hey, but anyway, right? Yes. So, high blood pressure is very important to keep under control, right? And again, a split second or a very short amount of time, if you run a foot race, that's one thing. But constantly, all the time, that constant pounding, 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 it's going to destroy. We're going to have a chapter on the kidneys, and we're going to do a lab where we open a kidney up, right? But what's going to happen is that anyway, it's going to be not good, right? And what goes together? High blood pressure, heart disease, kidney failure. What's the fourth one? Type 2 diabetes, right? Yes. Oh, what's the fifth one? Dementia. All of those, right? Love and marriage. They go together like a horse and carriage, right? They go together. So, but anyway, so that's one of the main causes of that heart's going boom, 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 and never getting rest. And you can do that. You can go with no rest for a period of time, but eventually it's going to get you, and you're going to be sick, and you're going to be flat on your back, right? And with the high blood pressure, they can do it for 10 or 15 years, but guess what? It's bad, right? Okay, coronary artery disease, right? You get a buildup of plaques in those coronaries, right? And that's going to cause your heart to fail. Okay, eventually it won't get enough blood. Okay, now remember we talked about if you have a heart attack and this part of your heart's damaged, right? And you get fibrosis, and this part of your heart gets damaged and you get fibrosis. Oh, and this part up here by the SA node gets damaged, right? Remember, that's going to be replaced with scar tissue, and scar tissue doesn't contract, right? And so that's going to weaken the heart. And when the heart becomes weakened, it can't pump enough blood. And so you can go into congestive heart failure. Okay? Now, next factor, genetics. 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 Okay? There are certain genes that interact. The main one I've heard is people like me. My people are from England and Wales. Right? My mother's part Scotch and Irish, so I got the worst of all four. But anyway, people with that Western European heritage, sometimes they have genetics that interplay, and they get congestive heart failure, right? And such. So genetics are a factor in that too, right? Let's see if we already talked about that. Coronary atherosclerosis. Yeah, clogging of the arteries can cause it. Persistent high blood pressure. Yeah, multiple heart attacks. Okay, one more. Dilated cardiomyopathy. Okay, dilated cardiomyopathy. Okay, I'm not going to draw a picture, but let me explain what that is. Dilated, to dilate gets bigger, right? Dilate, yes. Okay, so what happens is this. Okay, my father had this. My father was a smoker for 46 years, and then he quit for 9 years. But what happens is it damaged his lungs and his heart. And what happens is, for some reason, these ventricles, they get kind of weak and flabby. And for some reason, the heart dilates and gets bigger. Okay? And so when that happens, these valves don't close all the way. You get incompetent valves. Okay? And there's several different things. Oh, by the way, you do a bunch of cocaine, you do the same thing. Can you say John Belushi? Tell me you've seen Animal House, right? Oh my God. You have to go home and watch Animal House, my word. You have to go home and watch Animal House, right? You have to. That's your assignment. I'm going to ask you next week if you watched Animal House. It's hilarious. But anyway, okay? John Belushi, he died like 39, 40, 41, somewhere along in there, right? And one of the things he had was dilated cardiomyopathy from way too much cocaine. But anyway, okay? So, there's also a virus that causes it sometimes, okay? And such. But commonly, you're older, and for some reason, we don't exactly know why, this part of the heart, it gets flabby, it gets weak. It's not buff like it used to be. And it just can't pump blood out as much as it used to. Okay? Dilated cardiomyopathy. The ventricles dilate, they get stretched, and they get flabby. The heart enlarges, the valves become incompetent, and it can be cocaine, drug toxicity, too much alcohol, and there are chemo drugs and viruses. Okay? Viruses. Okay? Now, real quickly, let's talk about if you go into congestive heart failure, right? What happens if the left side of your heart, pardon me, the right side of your heart, okay, patience, right? The right side of your heart, what's going to happen? You can't pump out enough blood, so what are your symptoms going to be? What do you think? If the right side of your heart can't pump out that blood, what's going to happen?
Fatigue?
Well, yes, but think about it for a minute, okay? My heart can't pump out that blood, but that blood's still coming towards the heart, right? So the blood's going to back up, yes? The blood's going to back up. Where's the blood going to back up if it's the right-hand side of the heart? Pardon me?
The left?
No, ma'am. No, ma'am. Okay? So basically, we have blood from all over our body comes here, right? It's the right side, yes? But if this is not pumping it out, the blood's going to back up, and guess what's going to be fat and swollen? Fingers, ankles, feet, right? It's going to back up all over, but especially the feet, the ankles, and such, right? That's what's going to happen because the blood is backing up. It can't get pumped out of the, it can't get pumped, it doesn't get pumped back to the heart because the heart's not accepting it. Sorry, we're not taking any of that. Just stay where you come from, right? Now, this side of the heart, the left side of the heart, what's going to happen there? If the left side of the heart, the systemic circulation, what happens if the left side of the heart fails? Well, the same thing. Blood's going to back up. Where is it going to back up, Miss Destiny? Where would you think? Don't say fingers, ankles, toes. Right? Where would it back up? Okay? Okay? This is not squeezing the blood out here. So it's going to back up here, and then it's going to back up where?
The lungs.
The lungs. Right? It's going to back up in the lungs, yes. And when you get blood backing up in the lungs, guess what's going to happen? Your lungs are going to fill up with fluid, and you're going to drown if they don't give you probably some Lasix, right? It's the most common one. They give you Lasix. And Lasix makes you do what? It's a diuretic. It makes you do what? Makes you pee, right? Yes. Get rid of that fluid. Because if you don't, then it builds up. Have you seen people? Oh, man, they look like crap. You take them to the hospital, to the ER, and they're like, oh, yeah. Give them a bunch of Lasix. And they're like, I've had patients tell me, yeah, my husband, he peed 4 or 5 gallons, and he lost 8 pounds overnight by the next day, right? And he could breathe a lot better. Where'd the water come from? Right? Yes, water, it responds to gravity if you're upright. At the bottom of the lungs, right? So you're only breathing with this part of your lungs instead of this part of your lungs, right? Yes. Or if you lay on your back, it's on the back, right? Yes. And so anyway, real important you get this. Left side of the heart fails, backs up to the lungs. Pulmonary congestion. Oh, by the way, remember we said, what's this? 24/10, right? But oh, by the way, if a bunch of blood's backing up, pulmonary hypertension, right? That's going to go way up. It's not going to be 24/10. It may be way higher, okay? Now, right side of the heart, he can't pump that blood out. It can't send the blood to the lungs. It's weak. Where's it going to back up? toes, right? Ankles, lower leg, extremities. Extremities, I should say, okay? Extremities. Okay? Okay. Okay. If the left side fails, you get pulmonary congestion. The blood can't get pumped out of the left ventricle. And the pulmonary congestion results in pulmonary hypertension. Fluid leaks into the lungs. Lungs fill up with fluid, and the person drowns. And again, we said you give them the diuretics, and that makes the fluid go off. If the right side, you get peripheral congestion. Peripheral meaning in the periphery, the fingers, the toes, the ankles, like that, okay? And blood stagnates in the feet and the ankles and fingers especially, okay? Now let me explain. When I was a kid, if you went congestive heart failure, you were not long for this world, Miss Dawn. You were probably going to die pretty soon. Now, it's amazing. They know what to do. They have amazing drugs, and they can, many times, I've had patients go in, congestive heart failure, and they're on death's door, and they bring them back, and then they just have to watch them close and keep their meds under control, and they got to go to the doctor a lot, and he can keep them going for many years, where when I was a kid 40 years ago, 50 years ago, you got it, you're probably going to die for it, not very long, okay? But it's amazing what they can do now, okay? Okay. What's the treatment for all this stuff? Number one, diuretics, so you get rid of fluid. Number two, if their blood pressure is high, you lower it. And number three, increase the heart contractibility, okay? Let me explain that, right? The oldest and the most common one. Now, I grew up in Houston, and in the backyard, we had oleander bushes. And Mom's like, don't be eating those leaves, right? And from the oleander leaf, we get digitalis. And what does digitalis do? Increases the squeezing of the heart. It increases contractibility of the heart. There are a lot of other drugs that do it now, but I haven't worked in a pharmacy in 40 years now, but anyway, that's the main one. They still use it. Lanoxin, digitoxin, there's a bunch of different names for it, which that's another issue. I think it's criminal. There's one drug and they give it 5 different names. I think that's criminal. I really do, right? Motrin, Advil, Nuprin, Motrin IB, it's all the same stuff. I think that's criminal that they do that. I don't think that's right. I think there should be one name for a drug, and that way if you know the name, you know what it is. But anyway, that's just my deal, okay? But digitalis, and you eat those oleander leaves, guess what? It can throw your heart out of rhythm. It can make your heart contract a bunch. And finally, heart transplant. If they have to, then they will give you a heart transplant, right? Yes? Now, realize too that the heart transplants, they don't do a lot of those. And if you have other factors, like you're really obese, or you are a heavy smoker and you won't quit smoking, and this and that, your number goes way down on the list, right? Yes?
Or if your A1C is up.
Okay. In England, they have socialized medicine, right? And if you need a hip replacement, if you're way overweight, they won't do it. Say, sorry, you're too heavy. Sorry. That's what socialized medicine does for you, right? Yes? Our system is awful. It's the best in the world, right? It has a lot of flaws and a lot of problems, but it's the best in the world, and you get the best care. Oh, by the way, if they think you got cancer and you need the MRI to check it out, right? Within 2 or 3 or 4 days or a week, you're going to get it here in the States, right? Yes? In Canada, we'll put your name on the list. We'll call you about 4 months. And what's happening over that 4 months if your cancer is growing, right? Right? So we have the worst system, but it's way better than anywhere else, I assure you, right? So, but anyway, okay, that concludes that chapter. Any questions, right? I just can't stress enough. You need to take care of your heart. You need to not clog up your lungs, right? You smoke, you put all that tar and nicotine in those lungs, and it becomes a dirty filter, right? And a dirty filter that's on your car, you can't get that gasoline through it, okay? So it's not good. Okay, now, back to this right here, okay? Now, here we go. We said I'm A, and I form anti-B antibodies. B, and I form anti-A antibodies, okay? We are going to use that. And we talked about how those antibodies do what? They cause clumping, okay? So, I'm going to give you a tray. I'm going to give you a tray, a little bitty tray like this. Yes, and it's going to look like this. And it's going to have 3 divots in it. And this one's going to say A, this one's going to say B, and this one's going to say RH, okay? And so what we're going to do is, we are going to poke our finger. Now, it's a very good idea. Oh, I can turn this off now. We don't have to put the lab on.